Good Friday, everyone. I would like to talk about pharmacy law today. Um, a lot of patients and some pharmacists confused about pharmacy law every day, especially um, retail pharmacists uh, and people who work um, at the chain pharmacy like CVS, Walgreens, Walmart. Um, they face with the pharmacy law every day. So I would like to talk some important pharmacy laws that may be benefits for both patients and pharmacists folks. So I would like to talk about Schedule 2 to 4 controlled substance prescriptions. Schedule 2 uh, is different uh, with Schedule 3 and Schedule 4 and Schedule 5 and the prescription only. So the Schedule 2, like oxycodone, um, you know, hydrocodone, morphine, uh, those medications, uh, controlled substance, Schedule 2 or C2 prescription. So, first, I would like to discuss about day supply. Okay, so excuse me. So the day supply of C2 prescription, um, the maximum day supply for the C2 prescription is 30 days. Um, but for some uh, C2 medication, the maximum day supply can be 60 days, like for the medication for the dextroamphetamine or methylphenidate for the ADHD. So those medication um, can be 60-day supply. And some injectable infusion medication during the bumps, um, they might be okay for 90-day supply. So for these uh, day supply limit is a different and vary state to state. So may need to check with your state law to see uh, what are the supply limits uh, for the Schedule 2 prescription. And the Schedule 2 prescription cannot be refilled. It's prohibited. So no refilling for Schedule 2 prescription. For some reason, prescription for Schedule 2 might be partial filled because they don't have enough medication in stock, so they are out of out of stock medication, and uh, in that case, the pharmacist might um, give you some partial fill, but it's very complicated to do the partial fill. You know, pharmacists need to um, dispense the rest uh, within 72 hours, and if after 72 hours the patient not come back for the remaining, then the pharmacist must report to the prescriber, the doctor who prescribes the medication. This little, it has some uh, complication if something happened after the partial fill. Um, and then it not permitted probation request, so the patient cannot request a partial fill. Uh, the partial fill only occur if the pharmacy uh, does not have enough medication in stock. So how long the prescription, the Schedule 2 prescription is valid? Depend on state. Some state, uh, it set the time limit like 30 days limit. After 30 days, um, the prescription is no longer valid. So um, you may need to get a new prescription for C2 medication if you cannot fill the medication within 30 days. Um, but for some medication, for some patients, like patients in long-term care facility, like a nursing home patient, or um, patient with a diagnosis of terminal illness, and the prescription may be valid up to 60 days from the day of issuance. So um, for the patient, the prescription um, can be filled within 60 days from the day the prescription was issued. So this is very important numbers and informations when you have the prescription for Schedule 2 uh, controlled substances. You need to know some basic information to avoid, the prescription become invalid, and make sure you get enough medication, the total quantity, um, the total quantity prescribed instead of a partial fill. If you uh, don't get a partial fill within 72 hours, then you cannot get the rest of the medication. And remember to fill the medication within 30 days. No refills permitted. Um, and then understand the state laws to make sure, if you have the prescription for dextroamphetamine or methylphenidate for the ADHD, and, some injectable infusion bombs, the medication for infusion, then you need to, make sure you fill the medication within the time limits. All right, if you have any question, please let me know in the comment below. I'm going to talk a little bit about Schedule 3 and 4 prescription. So Schedule 3 and 4 prescription.